Neighbors United COVID-19 Virtual Community Forum in Town Hall. I'm Tara Wolfson. I'm the director of the Idaho Office for Refugees. And just to give you a brief overview of Neighbors United, we're a collaborative of individuals, community leaders like yourself, organizations, and companies that work together to help refugees in our entire community thrive. And over the past month, we've been working really hard to get accurate information out to our communities, our refugees communities and other immigrant communities around COVID-19. This forum will specifically focus on health. We realize that there's other topics that people would like to address, so we'll get to those at later forums. Also, I do want to tell you we're going to start off the first half of the panel. Last weekend, we met with over 30 community leaders to collect a bunch of questions. So we made sure we hit some of the most pressing health questions that people have. So we will be doing that for about the first half of the webinar, and then I will unmute everybody and move you over so people can ask questions, have a discussion, talk. So that will be probably the last half an hour, 40 minutes. But during the webinar, at any time, if you have questions on Facebook Live, please type your questions in the chat there or in the comment on Facebook Live. If you're on the Zoom meeting, please put your message in the chat and we'll be monitoring those and make sure that we do our best to answer as many questions as we can at the end. And again, at the end, we will unmute microphones and make sure that people can have an opportunity to ask questions verbally. So with that, I'm really excited to introduce Dr. Abby Davids from Family Medicine. She's graciously volunteered her time to host this panel. So she's going to introduce the panelists, and I do want to thank the panelists and for everybody who put this together. So I'm going to hand it over to Abby. Thank you, Abby.
Hi, good morning, everyone. Thanks for joining us. Today we have a panel of several health professionals to talk with you. We have Dr. Chris Hahn, who's our Public Health Medical Director here in the state of Idaho, and our Chief Epidemiologist. So she'll be talking to us about a lot of exciting things. We have Dr. Swidhan, Marwan Swidhan, who's an infection control specialist here in Idaho. And we have Dr. Mohammed, who is a resident physician over at the VA, and then me, I'm a family medicine doctor at the Family Medicine Health Center. So we're really excited to talk with you, and with that, I will go ahead and get started with our first question. So the first thing that we wanted to talk about is just what are the basics of COVID-19? How do people catch it? How can you protect yourself and your family? What might happen if you get sick, and where can you go for help? And for that, I'm going to hand it over to Dr. Swidhan to talk. Marwan?
Hi, good morning, everybody. Thank you for having me today. It's an honor to join everybody here. Speaking about COVID disease, the basic of COVID disease, it's a respiratory illness. That means the virus harbors your lung and the lung tree and airways, so you can expel and shed the virus through the respiratory droplets when you cough or sneeze or talk. And that is the main route of transmission. So if these droplets travel to another person and touch face, for example, or mucous membrane in nose, mouth, or even eye, it can transmit the virus into your respiratory and you can catch that disease. Another route for transmission, if a person cough in hand, for example, and touch a surface, that surface will be contaminated. So if you gonna touch that same surface, your hand will be contaminated, and when you touch your face, that's another route for transmission for you. So mainly by droplets through cough, sneeze or talk, or by contact with contaminating surfaces. To protect yourself, you have to stop these processes by wearing a mask. Stay with more than 6 feet from people, and the 6 feet for it's roughly 1.8 meter or 2 meters to round it up. And that's the distance that is kind of safe for droplets not to touch you if somebody cough. Also, if you are outside and touch different surfaces, make sure to do hand hygiene at all time. And the CDC actually have a good recommendations for when to do hand hygiene if you are out or even in house. However, with all these precautions, you can still get it. And when you got it, what will happen to you is that this COVID illness, and the doctors will talk more about that, it can cause either asymptoms, no symptoms at all, or even mild symptoms, the majority of people, or severe symptoms. So if you have no symptom or mild symptom, our recommendation is to stay at home, take care of yourself, stay away from beloved ones, family members, in household, use different utensils in house, make sure to do hand hygiene, to wear a mask, call a doctor, do not go to a clinic, call your primary care physician. If not, call any hospital. There's numbers available for you. And ask them about what's the next step for you. You also need to monitor your sign and symptom. So the main sign and symptom is fever and cough. If your fever start to increase, if you have trouble breathing, if you see yourself deteriorating, that is when you're gonna seek help, call doctors, arrange a visit with them, and go to see your providers if needed. The hospitals around the Treasure Valley have drive-through clinics. You can go to any one of them, and you can get tested there. Or you can contact your family physician, and they can direct you to a certain location.
Great.
I hope that answers all your questions.
Great, thank you so much. Yeah, so we'll go ahead and move on to the next question, which is a big question on many people's minds. What is Idaho doing to protect people? And Idaho's doing a lot of things, and I'm going to hand it over to Dr. Hahn. Hopefully we will be able to hear her to answer this question. Chris, I don't think we can hear you. Are you on?
So Chris, it looks like you're on and you're unmuted. So if you want to type in the chat, or potentially, I think that.
Yeah, let's move to the next question, Abby, and come back to this one.
Sure, we have a couple of questions for Dr. Hahn here in a row, and so I'll go ahead and move on about things that are happening statewide. And let's go over to Dr. Mohammed and talk about vaccines. There's been a lot of concern about vaccines lately in our communities. And so we want to talk about if other vaccines that we get might make us get coronavirus and some of the other issues going on with vaccines. Dr. Mohammed, go ahead.
Hello, everyone. Thanks for having me here today. Basically, if I talk about the vaccines are somehow very safe, and it's not known that they can cause the coronavirus. And this vaccine is even before they brought to the market, they undergo a lot of clinical trials and also lab testing, and after that they are being tried on a small percentage of people who are volunteers. And then at this stage, if they are effective and safe, that's the only time they are brought to the market, and after the approval of the FDA. And but like any other medication that we take, the vaccines can be, they can have side effects, and these side effects are minor side effects. Like, for example, if the person takes the vaccine at the site of injection, they can have pain, or also they can have redness, or they can have mild grade fever. But these are minor symptoms, and they go away on their own. And so if, for example, if someone have any question in regards to the vaccine, they usually can ask their healthcare providers, and then they will be addressed their concerns.
Thanks, Dr. Mohammed. I have heard from a lot of my patients that they're worried if they get vaccines in clinic that will include a coronavirus vaccine. Can you talk about that? Is there a coronavirus vaccine right now?
At the moment, there is no vaccines for coronavirus, but there is some studies suggesting that they are under development. But for right now, no, there is no vaccine for the coronavirus.
Yeah, I think that's an important point for people to know, that the vaccines we're giving in the clinic right now are the vaccines that are the same vaccines that we've always been giving, and they're really important to protect people from other infections. But right now there is no coronavirus vaccine that's being given in any clinics, and so hopefully that is important information for people. Is there anything else, Dr. Sweetan, that you would like to mention about vaccines?
No, not really. We just recommended that for the people to take care of themselves, follow the vaccine recommendations, contacted their primary care physicians to make sure that you are up to date with your vaccination.
And Abby,
Dr. Davis, oh, go ahead.
I saw, yeah, Dr. Han is with us now, so I'm going to go back to our second question, which is, what is Idaho doing to protect people? And Chris, take it away.
Yeah, and thank you, and I'm so sorry for my technical issues. I use Zoom all the time, but for some reason today my connection seems to be poor, so thank you for your patience, everybody. And I'm going to try to share my screen while we're talking if possible. So I'm going to hit the share screen, and we'll see if we can make this work. I'd love to show you guys. So I work at the state health department. Many of you on the phone might be familiar with the health departments. We have local health departments around the state. And then here in Boise, right on the Capitol, right near the Capitol building, we are the state health department, and we work together with all the local health departments to kind of coordinate what we're doing. And we've been very busy, as you can imagine, with this COVID response. So let me know if you guys can see my screen.
Yes, that looks great.
So can you see the Capitol, the stay-at-home order page? I've got two screens. I want to make sure you're looking at the right one.
Yes, it's the
okay,
coronavirus.
Perfect. Okay. So I just wanted to first mention that it is very hard. It has been such a, we are used to working on all sorts of public health issues, but of course, none of us have ever worked in a pandemic before. So this is new for everybody. And I want to apologize, first of all, from the health department for any of you that have not always been able to get information quickly or in your language or out to your community directly. You may know that we work very closely with Dr. Davids and the family medicine residency in helping support the health screenings. I also work closely with Marwan in infection prevention and control issues around the state. But the pandemic is so new for all of us. We're working very hard to get good information out. This page that you can see now on your screen, for those of you that are able to see this on the screen, is our main page in Idaho for coronavirus information. And it's we think it's a fairly easy website to remember because it's coronavirus.idaho.gov or .gov. And that's your one-stop place to go look for the latest from the state. This is on the governor's website, but all our health department data you can see right off of it. And I'm going to scroll down so you can see, for example, if you want to read what did the governor order, what does the law actually say that he put into effect with this order, you can see there, view on the stay-at-home order and click on that. And you can also go down and see when it got changed, what got changed, and read through that. There's guidance for businesses too on how to safely reopen. We're very excited that we are hoping to slowly but safely start reopening business. And you can see here, if you scroll down on the page, you can click here. This is the basic numbers, but you can click here, and that takes you to a much more, for those of you that like data, I like information and data. This is where the news media is getting all their numbers from. So these are the number of people in Idaho that have gotten coronavirus, have been diagnosed. We've now had over 1,800 patients with coronavirus in the state. You can see here how many their deaths have occurred. You can see here race and ethnicity for those people that have died. And if you hover, if you scroll around, you can see more detail. So for example, the vast majority of our deaths have been among persons who are white. We've had a few deaths in Asian Americans and a very small number of deaths in Black persons. We've had most of our deaths have been in non-Hispanic people, but in a few deaths have been in Hispanic people. So you can go anytime and look at these numbers. You can see how many people have been among healthcare workers, etc. So there's lots of data here, and I won't go into this, but you can scroll across the top here to get data from our emergency departments and also data by, I'll quickly click on the county because I think that is important for, depending on where you live, you can see by, here's Ada County at the top, and you can see most of our cases have been right here in Ada County where I work, and you can see how many of those were probable cases, how many people have died, and so forth. So anyway, as far as what we're doing, we're trying to get information out to people. We're trying to work with local health departments to make sure people have access to testing, to information, and we're also working very hard on helping businesses to reopen in a way that keeps people safe. So I think I'll leave it at there because obviously that could be, I could go on longer, but maybe I can always talk about it more later at the end if we have time.
Great, thank you so much, Dr. Hahn. That was excellent. We actually have another question for you about the reopening plan. How long will we have to stay home, and when will schools and jobs reopen?
Yeah, that's a great question, and fortunately we have some answers. So, and I should have kept you on my screen, but if you go to that coronavirus webpage, you can also click on, there was a link right on there called Stages of Reopening, and that has all the information about businesses, when they can reopen. As you may know, there are already some businesses that are doing things like takeout and curbside delivery, for example, restaurants, but starting May 1st, many businesses will be able to open as long as they've developed a plan on how to keep people safe. And I think a main part of that might be things like employees wearing face coverings or masks, only letting certain number of people into the store, those kind of things. But if you go on the coronavirus page and click on the reopening tab, there you will see guidance for businesses. And please feel free, if you have questions or concerns, to call your the Small Business Association, the governor's office. There's a hotline businesses can call. And in particular, I'll mention restaurants. Restaurants, it's going to take another 2 weeks before they can safely open, because restaurants will need to work with your local health departments to make sure that you have a plan in place for keeping people safe, because restaurants are challenging. People sit there a long time, they are eating. You obviously can't wear a face covering, while you're eating food. So there's going to be some extra challenges for restaurants, but the plan is to hopefully open them as well. And then schools, I'm sorry, I just saw schools in there. So schools, I don't believe, now the school board is going to make those decisions locally. So school boards and local school districts are going to decide that about when schools can reopen. I think most schools in the state will probably not open up until next fall. I think there's still too much concern about how they can safely let lots and lots of kids go back together. But we'll see. It is up to the school boards, though, so let your voice be known if you have concerns or would like to express your preference on how that goes.
Thanks, Dr. Hahn. And another question that's important to a lot of our community and just came through the chat. What about faith-based organizations, churches, mosques? What should they do when they reopen, and how can they keep people safe?
Exactly. So you may know that churches and mosques and synagogues will all be able to start having persons go back to their facilities and worship together starting May 1st, but it is requested that I know the governor has had conversations with faith leaders around the state about this, about having a plan, again, to keep people safe. Churches and synagogues and mosques are famous for having, old people mixing with young people, which is great, and little children, but there's a lot of possibility for transmission there of virus. So that is up to each school, or excuse me, I keep saying school, each church, synagogue, or mosque, or place of worship to think about by how to educate people coming in, keeping them as separate as possible, maybe not having shared meals or, church suppers kind of things, but trying to keep people as safe as possible while allowing them to express their religion.
Great. Thank you so much. I'm going to go on to a question about hospitals and clinics. People have a lot of questions about how do they get care that they need when it is reiterated over and over to stay home. So about the hospital, there's some questions about why do I need to go to the hospital alone? And are there other options instead of going to the hospital? So to talk about the hospital part, I'm going to hand it back over to Dr. Mohammed.
Can you hear me?
Yes.
Usually when people, for example, our clinic patients, whenever they call us and then we suspect that they are having the symptoms of the COVID-19, we usually send them to the hospital, to the ER, because over there they are healthcare professionals which are trained for this, and then they also over there they can get tested for the disease, and also get treatment and determine the severity of the disease. That's why we usually send them to the hospital instead of coming to the clinic.
Thanks, Dr. Mohammed. I think a concern from a lot of people has been, what if they need to go to the hospital for a different reason, to have a baby or to get care for some other medical problem? Visitors are limited, and that can be scary for people. Do you want to talk about why that is?
This is also, again, it mainly involves because of we are trying to reduce the exposure of the disease. For example, at the hospital, that you can get exposed to the disease if there is some others who are having the disease. And then also we are trying to implement the home stay guidelines. For me, this is the reason why the hospital visitors are limited, and as well as even if there is for other reasons, they are coming to the hospital in order not to spread the disease even more.
Yeah, thank you. So we want to take care of people in the hospitals, and there are certainly still reasons to come to the hospital, but to limit the number of people there, that most of the hospitals in town are asking for just one visitor during that stay, and that's to help keep everybody healthy who's already healthy. There are lots of ways to access your doctor during this time, though, if you need them and still stay home. And so I'm going to talk about this a little bit. Many clinics, including family medicine, have set up what we call telemedicine, or visits that happen with a video or on the phone, similar to how we're doing our meeting today. And so that's a great way to check in with your doctor, get care that you need, especially for your chronic medical problems, homes, but also be in your home and continue to stay safe. And so there's lots of different ways to do this. They are the ones that the clinics are using have a security feature on them. And so you can be reassured that you are just talking to your physician or your provider and not someone else. At Family Medicine, we're using a variety of things, including Zoom, including a way to go straight through our internal medical record. We've even had some visits on WhatsApp, as that's very familiar to people. And then, of course, if video doesn't work for some reason for someone, we can have a visit over the phone as well. And so those are really great ways. If the visit is interpreted, we just have the interpreter join into the visit, and it's been working really well. And so I would encourage you, if you feel like you need to have a visit in the clinic, to call and see if that's an option for you. There are still some visits that need to happen in the clinic. And so most primary care clinics, family clinics are open just for limited sorts of things. And so for us at Family Medicine, that includes things like visits for pregnant women, visits for children who still need their vaccines. That's still very important for people to stay on their regular vaccine schedule and get the vaccines that they need, especially young children who are under 2. So we're still seeing those people, people that need a visit for something acute that's going on or that might really need to be examined by a doctor. So those are still happening, and you can still get care that you need in the clinics. When you come into clinic, you will be asked to wear a mask or a face covering. So if you've got one of those, then please wear it. If you don't have one, you'll be given one when you come in. And you'll also be asked some questions about any symptoms you might be having before you enter the building, and that's for everybody's safety. And so you'll be asked about things like fever or cough or trouble breathing. And if you are having those things, then you'll be seen kind of in a different spot to evaluate for coronavirus rather than in the regular clinic, but again, still can be seen. And so I think hopefully that's reassuring to people. We have a couple of slides in other languages as well. So this is just what I said about accessing care through telemedicine, but in Kinyarwanda, if you want to take a look at that. And then also in Swahili here, and we're working on them in additional languages as well. So please know that you can still access your doctor. It might look a little bit different than it used to, but everybody's working hard to keep each other safe, but also continue the medical care that people need. And with that, I will move back to Dr. Hahn. There's a lot of concern in the community about why are so many people of color contracting the coronavirus disease, COVID-19. Dr. Hahn, do you want to talk about that?
Yeah, I certainly will. First of all, I want to mention, and I briefly showed you a little bit of information, but we are not so far seeing that in Idaho, but certainly in other parts of the country that has been a concern. That not only are people of color, whether it's African American or other persons of color, appear to have higher rates of illness, but also higher rates of severe illness and bad outcomes, including death, especially out of New York City. And I think the reasons for that are not completely understood, but there is a couple thoughts. One is that because it's sometimes in urban areas especially, it is the more crowded together people are, or the more people in a household, the more easy it is to spread, especially to older individuals who might be exposed to grandchildren, that kind of thing. There's also a concern that people of color, especially in New York City or that part of the country, may not have as good access to health care. So they're not getting in to see the doctor as quickly to make sure that they're being managed and treated and given advice in a quick manner. There's also concern that due to long-standing, less good quality care and inequalities in health and in economic status, that people of color in this country have higher rates of obesity, of untreated hypertension, of untreated underlying health conditions. And unfortunately, we know now that with coronavirus, two things are clear. The older you are, the more at risk you are of getting a severe case and ending up in the hospital. And also, the more other health conditions you already have, so heart disease, lung disease, those kinds of problems, if you already have those kind of health problems, you do even worse with coronavirus. So I think the concern is that those are all coming together in some of these communities and causing worse outcomes in the African American and other communities of color. I think I'm hopeful that we don't see that in Idaho. We have not so far seen that happen. As I showed you earlier, if we look at our death data, we've had almost all of our deaths. We don't want to see any deaths, of course, but almost all of our deaths have been in white, non-Hispanic individuals. And they've almost, I didn't show you this data, but they've almost all been in elderly, extreme elderly folks, especially those living in nursing homes, that kind of thing. They have a lot of health problems, and this virus is very tough on them. So I know that's not a perfect answer, but I would say we are working very hard to try to not have a health disparity problem with this virus in Idaho. We are hoping that information, good health care, access to treatment, and hopefully eventually a vaccine is available to everybody, and the good information is getting out to everybody so they can take care of their health.
Thanks, Dr. Hahn. This is a good segue to our next question, which is, why is self-care important? This is a really hard time right now. What are some things that people can do to keep yourself safe and sane during this time when we have to abide by so much distancing and it can feel a little bit isolating? Dr. Sweetan, do you want to start that off?
Yes. So just like Dr. Han indicated or mentioned, a lot of refugee communities or immigrants, they are living in urban areas and dwelling in together in a household. So you can find multiple generations through one household. When you are in a lockdown situation or when you are confined to home, it's very important to take care of yourself and the people around you if you have multiple generations by putting a plan. The first step in the plan, you have to identify who are people at risk. So your grandpa, your grandma, people who have chronic illnesses, especially respiratory illnesses, they are at risk. Pregnant women, they are at risk. So when you have a plan in your house, you need to consider these people and their risk factors. It's very important to take care of your health, eat well, sleep well, try to reduce the level of stress, try to engage more in activities with your family, try to educate them about, hand hygiene, masking. There is a good household checklist on the CDC website you can look at. It can help you plan your things to do in home. Try to, have some engagement through social medias. There's a lot of social medias outlets now. They are improving their interaction interface. So these are the things that you can do very quickly. If you are in a job that require go back and forth, make sure that when you go to work, you also have a plan to distance yourself from others if possible. Wear your cloth mask, do hand hygiene, be cautious about what surfaces you are touching. Make sure when you go home, before you go home, to do hand hygiene, and when you reach home, before you give a hug to your beloved ones, to do hand hygiene and make sure that your movement and your cloth and your stuff as well, having some plans for them. Another thing you can do is that when you go outside for groceries, also make sure that to maintain your safe distance and take precautions. Have a plan to when you go to grocery store, how many trips or frequency that you go to, what things you need to. It's not time to actually roam around the grocery store to think about things. Have a list before you go there so you can go in and out very quickly. Show courtesy for others, especially seniors. And these are the things you can find more details about that in the CDC website. They have a great checklist, what to do at work, at home, in areas that there is some gathering, like the faith-based practices for Muslims, Christians, and Jews and others. Try to contact with your religious leaders to see if you can attend via online. A lot of masses now, or services, faith-based services, they are doing online. Before you go, what needs to be done, what's the route to go, have these plans handy, and that can help you. The goal is to break the chain of transmission, which is droplets from respiratory products, and contact, which is touching contaminated surfaces. So these are the main things they need to focus on. Social distance can help you with that, and masking and hand hygiene can help you with that.
Great, thanks so much. A lot of people are wondering about testing. How can they get tested? Does it matter about immigration status, and how much does it cost? And I will let you know that at many clinics, different places in town, including our clinic at Family Medicine, we do have testing for people who have symptoms. So if you have an illness that is concerning, that it might be coronavirus, then we absolutely can test you, depending on kind of what your underlying medical conditions are, and how sick you are. Sometimes that test goes to a variety of different labs, and so the cost depends on which lab it might go to. Insurance, including Medicaid, will cover that, and if you don't have insurance, then most labs have a sliding fee scale. Immigration status does not matter in terms of that. Everybody has access to testing. There's a couple of different types of testing. There's our testing that we use to detect active infection, and then there's been a lot of talk recently about antibody testing, which is used a little bit differently. And not something that we do to detect active infection. And there was just a question on the chat about that. So I will send that over to Dr. Hahn. Dr. Hahn, do you want to talk about the role of antibody testing?
Yeah, that's a great question. Antibody testing is really a big challenge right now. There are antibody tests you can get out there that are being offered, but it's not yet clear what they mean. We're not 100% sure that antibodies mean immunity. We have some diseases where you get antibodies to something, and that means you're immune. That means you're safe. You probably never get that disease. And there are other diseases for which you can have antibodies, but that's not so clear. It might indicate you've been exposed to that virus, but it doesn't mean you're 100% protected. So what I tell people right now that are interested in antibody testing is go ahead if you think you might have had the disease and you want to check, but don't feel that you are 100% safe if you have antibodies. So I think we'll see that improve over time. I think the antibody tests will keep getting better, and we'll have more and more interest in doing antibody testing. And so stay tuned. I think that message might change over time. And can I say one more thing, Dr. David? I want to apologize. I've been calling Marwan because that's what I always call him, but I should be calling him Dr. Sweedan. And so I'm very sorry.
No, you don't need to. It's a pleasure to work with you, actually. I'm one of your
right.
soldiers or student.
Exactly. One of my buds, so.
Yeah, thank you.
Thank you for talking about testing. And yeah, so just to reiterate for people, the test that detects if you have infection right now is one that goes up the nose, and it's that picture there, kind of that little swab goes up the nose, and then we send it off to the lab. And that's a test that we do for people with symptoms that are sick, to find out if their sickness is caused by the coronavirus. And a lot of clinics are marketing drive-through testing, where you stay in your car and you go through, you get your swab and you leave. But that works for people who have a car. It doesn't always work for people people who don't have a car. So lots of places can accommodate that. For example, at Family Medicine, we have sort of a walk-in type place where people go in to be tested. Again, it is a discussion with your doctor first about whether you need a test before that test is happening, but you don't have to have a car in order to get tested. So we have a couple more questions before we move on to the just live questions from the audience. So I'll go to the next one, which is about essential workers and farm workers, including those in refugee communities. What's the state's testing and tracing plan for those communities, and how are health departments reaching out to those communities? And I will give that as well back to Dr. Hahn.
Yeah, sure. That is a great question. I will tell you that we do not have a coordinated state plan yet. We have been struggling since the beginning of this, as have other states around the country. It's not just Idaho. We do not have enough tests for everybody. And that's why we've been right now asking to save the testing for the people who are really sick or even in the hospital, certain high priority folks like the people in the nursing homes I was talking about earlier that are older and might be more susceptible to severe illness. However, that is all changing. The testing is getting more available, and we actually had a team that met just earlier this week. I think it was on Thursday, including doctors and other representatives from St. Luke's Health System, from the VA Medical Center, from the emergency provider community, so that's your ambulance drivers, those kind of folks. And we had a very good first meeting to talk about developing a better and more complete testing strategy that we can talk about and make sure everybody knows where they can get tested, when it makes sense to get tested, and so forth. So we are just beginning that. Stay tuned, but we agree we need to have a better statewide testing plan, and that will eventually be put on that coronavirus website, and we'll try to get messages out once that's available.
Thanks.
Oh, and I'm sorry, I'm sorry, Abby, Dr. Davis, you asked also about essential workers, farm workers, immigrant and refugees communities. The plan would be that testing is available to everybody. And we want to especially focus and make sure that we're offering testing, not forcing anybody to get tested, but that testing is available to people who are immigrants, farm workers, people in populations that might have a harder time getting access to health care.
Great. And is there any plan from the state or the health departments to reach out to farm workers or other essential workers and make sure their employers are knowing how to follow all recommended protocols and keep people safe while they're working?
Yes, those guidelines are just being developed as people start coming back to work. As some of the really tough ones, actually agricultural workers in some ways are hopefully going to have an easier time because if they're outdoors, we know that the virus does not survive as well outdoors. Also, there might be easier to stay more separated from other people. We're working on guidance, though, for agricultural workers. I saw something just this week come through that we are starting to work on advice for agricultural workers. We're also working on advice for people like beauty salons and health clubs and things where people are often very close together. So we need to figure out and put out guidance, and we will put out guidance for each of those different professions.
Great, thank you so much. Last question that we have is, obviously things are changing all the time. It can be hard to keep up with what's going on with regard to the coronavirus pandemic. And so where can people get information and help about COVID-19 in their own language that is not just in English? And Dr. Mohammed, Dr. Swedan, would you like to speak about that? We do have this one resource here on the slide.
So yeah, I can, the CDC website have a multi-language information for people who seek informations. Also public health hospitals can provide information through interpreters. And I would like to emphasize on one point is that what happened in Idaho is different than what happened in other states like New York or Michigan or even overseas. So really the residents of state of Idaho should go to local sources to obtain an accurate information, which is the Public Health Department website, the governor website, the hospitals, and the CDC, and not to obtain information from Facebook or other social medias or even media news, because it might be misleading, not accurate, does not reflect what really happened in Idaho. Dr. Han is leading the fight against coronavirus or COVID, disease here, and she is doing a wonderful job, and we all support her. And she lead the source of truth for the state of Idaho with the doctors, with the healthcare workers here. You can always reach to any clinic or hospital. They can provide interpreters, and there is the link on the slide or the screen. You can click on it. There's also some information on the CDC website you can go to and have more information. If you don't find your language, that doesn't mean that we cannot provide you with an interpreter can explain some information for you. So please be aware of that.
Great, thank you so much. And so now we're going to go on to a portion with questions from the audience. And so we will unmute people and they can ask questions. There is a slide up about how to ask. You can ask in the chat on Zoom. You can also ask in the chat on Facebook Live. Someone is monitoring that, and in the Q&A here on Zoom. And so I will start with the first question that came through the question and answer on Zoom, which is again about guidance for work facilities, especially food processing facilities. Dr. Han, people work in very close quarters at those facilities like the beef plant or the chicken processing plant. Do you have specific guidance for workplaces like that?
Yeah, thank you for that question. So as I mentioned, probably for all the questions about guidances, please do go to the coronavirus.idaho.gov website and click on the stages of reopening button, if you will. It's a big blue button on that page. In fact, Abby, during this, if you want, you can let me share and I can point that out for people again, in case people didn't see it when I showed them the page earlier. But that's where all those guidances will appear one by one. We are working on them. But absolutely, those types of workplaces are, I agree, important that we address. And there will be guidance that I'm not sure how specific it will be for, let's say, food processing compared to other types of businesses, but there will be all sorts of guidance for business on that page. That's definitely the way to go. And I may have mentioned there will definitely be separate guidance for restaurants.
Thank you so much. We have another question in the chat about reopening Idaho, and so I'll give this one to you as well, Dr. Han. Someone is saying the numbers are not decreasing. We had 34 new cases yesterday. Is it really safe to start opening Idaho? And is there a way, are we worried about having a second?
Yes, yeah. So first of all, can you see my screen now? I just shared it. Can you see the?
Yep.
Yeah, Abby, can you? Okay. So I wanted to get back to my previous question. In fact, I'm going to move this over. You can see the stages of reopening button here on the main page. And this is going to be where all these guidance you can see here, this takes you to resources for businesses, the different stages. So this includes all the dates that things will happen. And so please do look at this page carefully and you'll see some of the resource documents that are coming out, not only about reopening like we've talked about, but also how to cover things like unemployment insurance and things like that. So this is all getting built out, but please do look at this line. And now, Abby, I've forgotten the question.
That's okay. I think it's just about safety and reopening. I think it's important that remember each step only happens with certain conditions, right?
Right, right. So in fact, let me see if I can do this because this is on, since I'm still sharing. If you look at our web page and you'll see that the plan, so again, you go to our main page and you look at our stages of reopening, and it's included in that. If you click on the stages of reopening, you can see what are we watching to make sure that what we're doing is working. And you have what we're calling our metrics or our measures, and here they are. So you see the criteria we're going to be watching. It's a little technical, but I think it's what we're going to be watching every day is we want to see a continued downward trend or low numbers of people coming to the emergency departments with this illness. We're going to watch it over 14-day periods, but every single day we'll check and look at in the last 2 weeks, is this changing? Is the average in the last 2 weeks changing? Secondly, we're going to be looking at downward trend in cases or low levels of cases, and that is fewer than 20 patients per day on average reported statewide. We're not quite there yet, but we are seeing a downward trend. And then in healthcare also, are hospitals doing okay? Do we have enough ventilators, intensive care beds, and safe equipment such as what's known as PPE or gloves, masks, gowns, and we will be tracking that as well. And then you can see here just one more set. I hope this isn't too much information, but one more set of measures that we will look for. So these are people being admitted with COVID illness, how our lab tests are showing, how many are positive, and we'll also look to make sure we're able to test our healthcare workers. So those are the measures we're going to be using to see if our reopening is working. Of course, we're worried that it won't go well. We're worried about that, but we feel that we have to put a step forward and watch and see how it goes. And if we need to take a step backwards, that might have to happen again if we start to see those measures not going well.
Great, thank you.
Just want to let everybody know that the attendees are unmuted. So if people have a question, you can ask by voice, just raise your hand.
We do have one more question on the Q&A, which is, again, people are pretty worried, it seems like, about the work conditions at food processing plants and other maybe factory workers. So this question is, why the delay in developing guidance? We have hundreds of workers in shops right now which are requiring close working conditions, meaning you can't maintain 6-foot distance between you and your coworker, and what recommendations we might have for places like that. Dr. Hahn, can I put you on the spot again?
Yeah, sure. Yeah, you know, that's a very good question. I totally understand that from the standpoint of a worker. It feels like that things are going slowly. I'll tell you from the standpoint of the state health department and the other folks putting this guidance together, we are working, 12, 14-hour days, 7 days a week to try to make this happen as fast as we can. So I do apologize that it feels slow. To us, it feels like, I always say tsunami, but it feels like we're just have so much work. And we are trying to do this right. We don't want to put out guidance or information that is incorrect. So we need to get it right. But we understand that everybody would like this guidance quicker. And we'll just keep working as fast as we can. And we are working with the local health departments. We're working with business agencies and other groups around the state. We talked earlier about churches and mosques. We're trying to work very hard with all our partners in the community so that we don't put out some guidance that people don't agree with and feel is bad guidance.
May I add into this, please? So our understanding about COVID and the movement of a virus is also evolving as now some information is coming up. So that's, one point that when we build a guideline, we want to make sure that the up-to-date and an accurate understanding of this situation or circumstances is included in these guidelines. And for the second portion of the question is like the distance cannot maintain 6 feet in some work areas. That is only if you don't have mask, because the respiratory droplet cannot travel more than 6 feet, which is about 2 meters. But if you wear a mask on and you take precautions when doing hand hygiene, in work areas that cannot maintain 6 feet, there is that can help the situation definitely. But also wait for the guideline based on your work areas. This guidelines will explain these things in detail.
Great, thank you. And we have just another question on the Q&A about what about in other languages so that non-English speakers understand what is going on about this guidance. And I think, yes, as things get put out, I think it's everyone's intention to put that in as many languages as is feasible. Dr. Han, do you agree?
Yes, absolutely. We do need to keep working on that. The guidance is coming out, so we want to get it out as fast as possible. So I understand that it usually comes out in English first, but it would also be helpful to know which guidances in particular are the most critical to get translated if there are some that are not available in other languages, and which languages are most needed. Would be happy to try to do better in those areas.
Dr. Han, this is Julianne with the ARC. We've done an initial round of translations and are happy to do any other critical documents that are identified by the group with local translators.
Thank you. That's really good to know. Thank you.
Are there any questions coming through the Facebook Live, or someone? Jonathan has raised their hand. Jonathan, do you have a question?
Yes, I do. Can you guys hear me?
Yep.
Hi, my name is Jonathan, and I'm a small business owner. I'm part of the essential workers, and we do non-emergency medical transportations. And we, like right now, we don't have any PPE, right? So we can't get anywhere to buy any PPE. Every time I buy them, 2 weeks later, I get a cancellation notice and stuff like that. And they're trying to open it up certain businesses and stuff like that. That means there's a high chance that we can transport a lot of people that can be asymptomatic, and we don't know. So right now we don't have face shields. I make masks for my drivers. We don't have gowns, but we do pretty much the same thing that the first responders are doing. Like we transport people in a wheelchair, stretchers, and all those kind of stuff. We go to their home, transport them from their home to hospitals, and yet we don't have any PPE, and we can't find it anywhere to buy them. They're opening up stuff. Where can we go and say, hey, here's what we're doing. Could you give us, like hospitals, like affiliated with a hospital, and get some PPE from them, or somehow, like how can we get the resources we need to help out in this situation?
Thanks, Jonathan, for your question. I think just to summarize the question about what sort of protective measures are needed for people not working in healthcare, but definitely working around a lot of other people. And Dr. Sweetan, as an infection control specialist, would you like to answer that?
Yes. So the requirement PPE is for the people who work directly with patients and have direct contact with patients, such as Jonathan's business. You need a mask, glove, eye protection, such as goggles or shield. Either one will be fine. And you don't need an N95 mask. You only need the surgical mask or the procedural mask. And of course, the gown and gloves, if I forget to mention them. All the nations now facing some challenging time securing these PPEs. So for your job specifically, what you can do is that you can use reusable gowns, you can use a cloth mask, you can use eye goggles that you can find in local stores. You can change those between patients. Make sure to clean patients' area and high-touch area in your vehicles with a low-level disinfection. Chemicals, and you can find a list of them on the CDC website. For those gowns and masks that is reusable, you can wash them. Soap and water can neutralize the virus and can kill it through residence machine or commercial machines. For the eye goggles, you can clean it with low-level disinfection chemicals. Again, when they are damaged or foggy, that's when you need to replace them. The CDC website have a good guidelines about reusable gowns and cloth masks, so you can refer to those and read them and try to have a plan. I understand your pain of not able to have the proper probably PPEs, but these will be enough for the line of work you do. One reason you are not facing the patients face to face directly. You don't do any aerosolized generating procedures in the vehicles. Recommend for the patients to wear a mask too, because that will reduce the risk of you getting, or any of your drivers will get the virus. If in case the patient refused to wear a mask, direct them to respiratory etiquette, offer them tissues to cover their mouth through cough. If you have some hand hygiene, you can offer them to do hand hygiene. To do so, some of the patients, they have their own. It's just educating your patients, be part of your transportation plan from point A to the final destination point B. That will be something also to consider. And I'm sorry, I don't have answer to you. I don't think the hospitals will be able to provide you. I don't want to talk on behalf of the hospitals, but just knowing the situation, some local hospitals, they switch to extended reusable PPE policy that was adopted from the CDC. So my recommendation is to look at those and try to have a plan for your business.
Great, thanks, Dr. Sudan. And just a reminder, if you are not talking, please go ahead and mute your phone. We have another participant on the call, Jean, who has a question if you want to go ahead and ask your question.
Oh yeah, I don't know. Can you hear me there?
Yes, you're good.
Oh, okay, great, wonderful. Yeah, my name is Jean, and I'm one of the pastors around with a local church. So first of all, I appreciate really, thanks a lot for having this kind of meeting where people discuss and share like a lot of information which will help others. After this meeting, we go out and share with like other people are not now in this meeting. So we say this is amazing, it's great. Thanks a lot. The other thing is that thanks again for going down to the ground and meeting the concerns and the people, because this last week I see that the churches and there's agency, there's some people from the churches, agencies, schools who are coming to refugees' house and to immigrant people houses and distribute like stuff and things. We do appreciate with that one. It's amazing. Thanks a lot again for that one. So I was saying, I know that many people, they may not have the chance like to go online and such and get like some information through like online system or websites, but that's just the way I know with my culture and our people. If there may be a system like printing some like flyers and they have people like distribute like to houses, we never know. Someone may sit in the house and start reading the thing, and then we'll get the information of how he can be safe. And if this will be followed with some kind of pictures, that would be great. Because some people, they may not read, but they may follow the pictures on those flyers, and they will just some kind of trying to share like the information. Maybe we may save one life or two lives of like people not be contaminated or know how to protect other people for not be contaminated. So that's something which I want just to share. If there is a way, even at the hospital, just to print like a lot of like flyers, and they can give patient to give to other people. Like if they speak Swahili, they send it in Swahili, or if they speak other languages, then they send these flyers in languages. And someone may be even at break time at work, and they may have to read it and see and check that. And also the people in the groups of like WhatsApp. I know some of the churches and other people, they have the groups where there is WhatsApps. They can send this one, their groups, then ask people to read and follow those ones. Thank you.
Thank you so much. That's a great idea. Yeah, we've been doing some of that at our clinic and at Family Medicine, and I know IRC has been making lots of flyers in different languages too. It's a great idea to mail those out. Anyone else have a question? You can raise your hand or type it in the Q&A. And I just want to check on the Facebook Live. Is anything coming through there? We have Tanya raised your hand. Go ahead with your question.
Hi, thanks. Yeah, so my question really is, and I apologize if this isn't the right platform, but it's about the small business loans. So, you know, I have several people that I know in the refugee community who own their own small businesses, and obviously, like all small businesses, they're taking a hit right now. And you know, the first stimulus package that was passed, they didn't get access to that funding. I know there's been a second stimulus package that's been passed. Do we know how that's going to make more of those emergency loans available, or if it will? So yeah, that's my question.
Thanks for that question, Tanya. Today's panel is really a medical experts.
Okay.
So I'm not sure that we have an answer on that.
And I'm just going to pipe in. This is Tara, the director of the Idaho Office for Refugees. And Tanya, we know that there have been lots of inquiries from small business owners. So that is a topic that we will be working like we did today to get experts on to address. So we will definitely, and this is a good time to say, if you have not yet shared your information with Neighbors United, I encourage you to write your name, email, or your phone number in the chat box, and we will add you to our list.
Okay, great, thank you.
Anybody else with a question out there? Just go ahead and Jonathan, you have a
yeah. I have question, please.
Okay, I'm not sure who's talking. If you just want to introduce yourself, and then Jonathan will get to you next.
This is Macambo. Wow.
Hello. Can you hear me?
Yes, go ahead.
My name is Beatrice. And then I'm sorry for my bad English. Maybe I don't know, some will hear me and some not, according to my explanation. As a provider for childcare, I know the school was closed, but we didn't close the daycare. So the problem is, like how Jonathan says, we don't have all the equipment to serve us. And then we stay with the kids for maybe 8 hours or 10 hours. According to the parents, they still going to work. And then we watch them. So our problem is we don't have that space to say one kid can stay a meter or 6 feet, yeah? And then we don't have any equipment. We don't know who is sick or not. But when you tell the parent to keep their kids at home. They said they can't, and that is true. They can't keep them at home and they are going to work. So it's look like we are not safe. And then we don't have any like thermometer to say we can test them if they have fever or not. And according to you guys, did you talk about those problems, or did you get any question before about that? And then what to do, because we have different kids, different families. We don't watch that only one family. We watch different, maybe three families per one time. And they came different houses. So that is big problem for us.
Thanks for your question.
What we can do now.
Yeah, so the question is about daycare areas, childcare areas, and how they can keep themselves safe. What kind of policies may be put in place? Dr. Hahn, do you want to take this question?
Yeah, I understand that is very challenging. We know that if we are going to help families get back to work, that we actually need more daycares to open, more daycares, the ones that have closed, to open back up. We need daycares to be able to function. But we also understand that parents need to work, and that not all daycares have the tools they need to stay safe. I know that we have another doctor that works with us in the health department, and she is working on guidance for daycares. And I will let her know. I think you have a very good point. I will certainly let her know that if there's a way to try to make sure you have ways to check a child's temperature, for example, that's really important that they would have that availability. And also, really, a lot of this comes down to sick leave. The parents need to be able to, if the child is sick, the parent should be able to take the child and keep them at home while they're sick, and not lose pay. And I think the governor's office is very aware that that's something we need to keep thinking about, is how to improve and make sure that workers have sick leave. So I'll leave it at that, but it's a very important point you bring, and we are very aware that daycares are a very, very important part of, and doing that correctly is a very, very important part of bringing Idaho back to work and having economic recovery.
And I'm just going to read a comment from Council Member Helly Burton, and he said, "I will make sure to bring up the lack of protective equipment for our refugee and New American community at the next City Council meeting."
Great. Thanks so much. Makambo, did you have a question?
Yep, I had one. Thank you. Okay, my name is Makambo. I'm working with Crazy Coupon Lady Foundation. We receive a lot of parcels and mail from Australia in US. And what I heard from the news on the TV, they were saying the COVID-19 spread from the parcels or the mails. So one of the questions I was wondering with is for how long the virus can live on the parcels. And the B of that question is, they say also the virus can be spread from the hair. So it's like the same for how long the virus can live in the hair. That's my question.
Thanks, Makambo. That's a great question. How long can the coronavirus live on surfaces like mail, and also how long can it live on hair? Dr. Hahn, Dr. Sweetan, do you want to take that one?
Yeah, I could start, and Dr. Sweetan might have some things to add. You know, there's only been one study that I'm aware of that's been published on this, and it was in a laboratory setting, so that's not necessarily how it works out in the world. But in this laboratory, they said up to 3 days it could potentially live on certain surfaces. And so one thing when people ask me about mail that I tell them is, you know, if you have the luxury of not touching it for, like let's say, putting it someplace and not touching it for 3 days, that's one option, then it'll probably be fine after that. The other thing to remember, though, is that touching things won't make you sick. The virus doesn't go through the skin in your hands, for example. What's important is if you touch something that you're worried might be contaminated, after you're done handling that item, you wash your hands and don't touch your face in between. That's easier said than done. We all touch our face a lot. You know, it's something we do without thinking about it. But just be mindful that it's not touching something that's going to make you sick. It's then taking your hand and then, you know, accidentally, you know, putting it in your mouth or near your eyes or nose or something that is the risk. And Dr. Sweetan, I don't know if you have more to add to that.
No, I agree with Dr. Han. It doesn't matter if the virus lived 2 hours or 3 days on a surface. What matters is that when you touch a surface, always assume that the surface is contaminated and you don't want it to touch your face or other people's face, like your children, your grandma, or your beloved one. So what you need to do is always be conscious about what you touch. Always do hand hygiene. That doesn't mean that you wash your hand every 5 minutes. It's just like if you touch a surface outside your area, what you believe that is clean is just always a good idea to wash your hand. And if the item that you touch in your home or in your church or your work is cleanable and you can clean that, it's always a good idea to clean that object just to make sure that other people, when they touch it, you know, they will be safe as well. But we wanted to emphasize on the point, hand hygiene is another weapon in your fight against COVID-19 disease.
Great, thank you so much. We had a comment in the chat that Tidwell is going to share linguistically accessible information addressing recommendations for self-care and the psychological impact of everything that's going on. And those will mostly be in a visual format that can be shared on things like WhatsApp and Facebook. So thank you for that. That will be very helpful for people. I believe Jonathan has another question.
Hi. Thank you for the gentleman who, the doctor who answered my question and help out understanding how we can reuse our resources and protect ourselves, and how hospitals are limited on PPE. And sometimes I'm like, when I go to the hospital, this thing is there. Like, can they share with us, you know? But thank you for bringing that up. And yeah, going forward, I will be very creative and other things, and think about how I can do best to protect my patients and my drivers as well. The other thing that also I would like to bring that up and share with my other fellow refugees, business owners, and that do an essential job. Like if they work at the daycare, if they work at like senior assisted living or hospitals as a CNAs and stuff like that. What I'm doing so far is when I come from work, the best way to go is like, if you have a garage, I go to my garage first and take all my clothing and everything, and then I change and I put a new clothing before I walk into the house. I personally have a direct contact with the COVID patients, and then I went and later on I tested negative, and I think because I'm doing all this kind of precautions, so help me it saved me from this kind of contact. And also all my drivers that have a contact with the COVID patient end up coming back negative. So what I do is pretty much like be aware of hygiene and, wash your hands, put mask on. Again, as the doctor said earlier, if you go to the store, make sure you have idea what are you buying, you're like in and out and stuff like that. So yes, I would like to thank you guys so much for the information and the resources you guys putting out there to help us understand and defeat this unknown virus. Thank you.
Great, thank you so much. We had a question in the chat from Tanya again that I will send to you, Dr. Hahn. Has the government in Idaho developed any metrics to inform us how effective social distancing and the stay-at-home order has been? For example, in Oregon, they said that the things that they did to enforce social distancing have saved as many as 70,000 people from being infected.
Yeah, thank you, Dr. David. That's a great question. So yeah, I saw that Oregon report, and I was thinking we should do the same. So the short answer is no. We've been very pleased, of course, to see that case numbers have continued to drop, that our percent positive of everybody we're testing, the percent that turn up positive are also dropping. So we're feeling good about that, but we would love to quantify it, and I think we should, because obviously we would like to be able to have comfort that our measures are making a real difference. It is possible that some of those numbers could have kept going up if we hadn't done the order, but we also, it's possible they could have stayed the same. It's hard to know what would have happened if we hadn't done them, but I did like Oregon's report, and I think we are going to try to do something the same. We'll copy them.
Great, thank you. We have just about 5 minutes left, and so if there are no other questions, I will go ahead and turn it back over to Tara.
So thank you, everybody. We're really grateful that you gave up an hour and a half of your day. A special shout out to our doctors on the line, Dr. Mohammed, Dr. Davids, Dr. Hahn, and Dr. Sweden. I know how busy you are right now. We're very thankful for all the work that you're doing. Thank you also to Neighbors United members and the planning team, IRC, Agency for New Americans, Glocal, and others who were part of planning this. And we do want to, and also community leaders. We had about 40 people get on the line to help guide this conversation. So we welcome feedback, input, better ways to get accurate information out to the public. We may take clips of this recording and interpret it into different languages, so please let us know if you think that that would be useful. So thank you again. Know that we're here, and I think the last slide has some contact information, how you can reach out to us. So have a great afternoon, and to all who are celebrating Ramadan, Ramadan Mubarak, and thank you again for your time.
Thank you.
Thanks, everyone.
Thank you.
And we will conclude the meeting.